you ever had an imaginary friend that you could tell everything to and they were always there for you? Have you ever made up a scenario in your head that resulted in you hurting someone because for whatever reason they irritated you? Going day to day with not being able to control your thoughts, your actions, and speaking in an odd language is just scraping the outside layer of a schizophrenic person. Some schizophrenics like to refer to their world as a walking nightmare. Schizophrenia is a very rare disease. Only about 1% of the world's population has it. It is a severe and disabling brain disorder. They believe others can read their mind and that everyone is out to get them and harm them. There are different types of schizophrenia, such as disorganized, catatonic, paranoid, residual, and undifferentiated. The early signs of schizophrenia include social withdrawal, hostility, no personal hygiene, inappropriate laughter or crying, depression, extreme emotions, strange vocabulary, and an expressionless gaze. The typical signs of schizophrenia include delusions, hallucinations, disorganized speech and behavior, lack of emotion, interest, in the world. Schizophrenia does not only affect the schizophrenic, it affects people that are around them, like their family and everything. It causes relationship problems, disruption to normal and daily activities, and typically they lead towards alcohol and drug abuse. They're more suicidal too. To be diagnosed, you need to have a psychiatric evaluation, medical history exam, and some lab tests. A brief history. It was first identified as a discrete mental illness by Emily Kraepelin in 1887. Documents trace back to as far as the second millennium. The symptoms were thought to be coming from the heart, uterus, blood vessels, fecal matter, poison, or demons. They believed an evil possession caused this. They would try to treat it by holding exorcisms, exposing the patients to music, or drilling holes into the patient's skull. Schizo means split and frenia means mind. What causes schizophrenia? Experts are unsure what it is exactly that causes it because there's so many different things. They think genes and environment, because there's a reoccurrence in families. About 10% of the people related to someone with schizophrenia will get it. It's not just one gene though, it'll be like multiple, and they also have found high rates of rare mutations in those genes. They think brain chemistry has something to do with it as well. They think there's an imbalance of neurotransmitters, dopamine and glutamate, and the ventricles are larger in people with schizophrenia. There's not a huge risk for people that have it because only 1% of the world's population will have it, but it does occur in similar groups. Hallucinations begin around age 16 to age 30. Men typically tend to show signs first, and it's rare in kids, but more and more are becoming or have cases of it. There's no permanent treatment for this because it's such a traumatic disease, but there's some medications that help a little. Okay, let's look at the types of schizophrenia. There's disorganized, which people tend to lose touch with reality. They cannot perform daily activities. Their frustration sometimes gets the best of them and they lash out at others. Their behavior does not make sense. This is typically the more severe type. Symptoms of this include disorganized thinking and behavior, absent and inappropriate emotions, seeing and hearing things that are not really there, odd postures, social isolation, and trouble functioning. Catatonic schizophrenia includes episodes of behavior at opposite ends of the spectrum. This is rare due to treatments, and typically people that have this have more than just the issue for schizophrenia. Symptoms include physical or excessive mobility, mimic speech and movement, delusions, hearing and seeing things, lack of emotion, trouble functioning, and social isolation. Paranoid schizophrenia is typically when people see and hear things that are not really there. They have a lot of delusions, they're typically suicidal, but their ability to function is good. They have anxiety, emotional distance, and they tend to be more violent. Residual schizophrenia refers to a past occurrence of schizophrenia, but there's no recent signs or anything. Undifferentiated schizophrenia is all the different kinds of schizophrenia all combined into one. Let's take a look at Jeannie Schitzfield. She was 6 years old when she was diagnosed with schizophrenia. When she was a baby, she was only able to sleep for about 20 minutes at a time. She was always occupied with something else. By 2, she could speak in full sentences, knew the alphabet, and could do basic math. Her IQ was 146. Her parents only thought that she had a good imagination. She had a little brother born, and when he was born, violence started occurring. Every time her little brother or Bodhi would cry, Janie would have an episode and say, "The rats don't like Bodhi," and she would attack him. She has over 100 friends. The most common ones include cats, which are 400, Midnight, Magical 61, and Emily 64. The girls, who are 80, 100 degrees, 24 hours. The rats, Wednesday, Saturn, and 200. The dog is Blink, and there's a bird named 34. Not all of her friends are bad, but if she doesn't hurt, the rats and the cats typically tend to bite and scratch her until she does. Without medications, Janie will hallucinate about 95% of her day. This resulted in her parents having to have 2 different homes to go back and forth so she wouldn't hurt her brother. Here's a picture of Janie and her dad, and as you can tell, Janie is just like a normal looking girl and just like normal, so there's nothing really different about it. That's it. Scan the audience again.